Good evening. I'm Tyler. I'm here at Marion Medical Center today. I'm about to perform a 4-view shoulder x-ray on a female patient of ours. I'm a first-year student at Santa Barbara City College, and let's get this going. Hi.
Hi.
Can I get your full name?
Marissa Williams.
And date of birth?
2/26/91.
Okay, can I see your paperwork? Alright, just want to verify everything. Okay. And you're here for which reason?
I lifted something heavy the other day and I felt my shoulder pop.
Okay, it does say it's your right shoulder, so I just want to confirm we're going to do 4 different x-rays. First off, any chance of pregnancy?
No.
Okay. I'm going to face the x-ray machine. I'm going to stick this right here. Oops, sorry about that.
It's okay.
So for the first couple projections, I'm going to be doing a AP, internal rotation of the right shoulder. Second one will be the external rotation. Third one, I'm going to do her in a Y view. It's going to be an AP oblique. And then the fourth view will be a superior inferior axial projection of the shoulder called the axillary. Yes. So first off, I already got my 2 detented to 40 inches SID. Got it centered, transverse, and longitudinally. I'm going to place a 10 by 12, and this little bar goes to the patient's right side always. I'm going to place the right marker. I'm going to go 1 inch inferior to the coracoid process, 1 inch medially to, 1 inch inferior to the AC joint, the acromion-clavicular, and 1 inch medially to the coracoid process. That's where my central weight is going to go. I want to make sure that I get the full clavicle and some of the proximal humerus to see the greater and lesser tubercles. I'm going to have you step to your left just slightly, right there. And if I can have you, we're going to do the internal rotation first. I'm going to have you place your palm of your hand up on your belly, just like that. And I'm going to use a technique of 70 at 4. She's pretty thin, so it should be plenty. Let's go ahead and do the first one. Hold still, X-ray, and alright, so next one, I'm going to scan this. This is a nice, fresh, clean image plate. She's going to stay in the same position. This time, we're going to have her externally rotate the humerus by rotating your arm towards me, yep, just like that, and hold. Same technique. X-ray. Alright, go ahead and relax your arm. Go ahead and actually place it back on your belly. I'll be right back. Okay. And for this one, this is going to be an AP oblique. I'm going to oblique her slightly. Internally or medially, about 45 degrees. And that looks pretty good. SID, everything still is the same. And we're going to keep, I'm going to bump the technique up to 70 at 5 because of the OID. Right. Okay, go ahead and relax. Alright, appreciate your patience. We have one more image to do. I'm going to place you at the end of this table, and I'm going to have you face this way. Place your arm out like this, and I'll position you the rest of the way. And I'm just going to place this over you. I'm actually going to stick it on one side only. There you go. And this is going to be a tabletop, so I can't get the Bucky that far. And what I'm going to do, just going to get her in a nice position. Go ahead and relax your arm. Can't really build up the ire anymore. As you can see, there's really no space to do it. So she's in a pretty good spot. I'm going to have her rotate her head away from the x-ray tube so I don't bump her in the head. For this projection, I would want to double check that there be no metal, bra straps, anything that would get in the way. So right now, getting my tube in place. And we're going to throw a little angulation in there so we can get inside the joint space. Still want to keep my SID at 40. Going to collimate, make sure I get proximal humerus. The top part of the scapula. And I'm going to have her just like that. And let me fix this angle. Oh, you know what? This tube just does not want to move sometimes. Just one moment, folks. Have a little minor difficulty. Hey, we like to have a little bit of fun on the job, right? This is a dinosaur room, so I'm in a little bit of trouble. But hey, it works. This is the right shoulder. I'm going to place the marker anteriorly. That looks pretty good. I am placing the central ray into the scapular humeral joint, and I'm going to keep my technique at 70 and 6. So here we go. X-ray. And relax. That completes your x-rays for today. I'll send those off to the doctor. I wish you best of luck. You have any questions?
No.
Okay. There's milk and cookies out in the front. If you're in a hurry for the results, give your doctor a call. Give him at least 24 hours. Thank you. Okay, so I've completed my 4 views. I'm going to evaluate the x-rays and make sure that I do not need to do any repeats and that the x-rays meet the criteria needed for each projection. So this first one is the external rotation. As you can see, this is the greater tubercle. This is going, the lesser tubercle is superimposed over the humeral head. That's what you should see. This is the clavicle, the lateral aspect, the lateral extremity. This would be the acromion. This would be the AC joint, the acromioclavicular joint. This little process here is the coracoid, and this would be the glenoid cavity, part of the scapula as well. The coracoid is a little process that hooks around off of the coracoid, or the scapula, anteriorly. The space between the humeral head and the glenoid cavity is called the glenoidal humeral joint space. This is a humeral body, and often you can see the outline border of the scapula in the background. It's not needed, but sometimes it's a bonus. Okay, for the next projection. we have the same thing basically, except for the medial rotation of the arm. So instead of seeing the greater trochanter, the greater tubercle, you're going to see the lesser tubercle. It's going to be over the scapula superimposed, but you can still see it here. The greater tubercle is superimposed over the humeral head. Here you would still see the coracoid process, the clavicle, acromion, AC joint, and some ribs. Right here you could actually see a good view of the scapula, superior, lateral border, fossa. It would actually be the subscapular fossa. And on to the next. This would be the wide view. This one's a little confusing at first until you've seen a few of them. Obviously here you got the ribs. Superior, from there you have your clavicle. And then we follow that, and we all know that the clavicle joins up with the acromion process, so that must be it right there. And from the acromion process, we know that there's also anteriorly the coracoid process. This would be the borders of the scapula. This is the humeral head, humeral neck, and this is actually a good projection. It's hard to see, but the humerus is in profile, well, in its position where it should be. It should be at the Y junction, and that's a good shot there. This is the superior inferior axial projection, the axillary. I might have said auxiliary in my film, but that's easily mistaken. So it's axillary. This is the anterior, posterior. How do I know that? Well, remember the coracoid process projects anteriorly, and then we have our acromion, which will hook up. Actually, I'm sorry, this is the glenoid cavity. It can be a little confusing there, but follow the clavicle, and the head meets the acromion process, and the scapula, humeral head, and glenoid cavity, the glenoidal humeral joint space. And I believe this would be the greater tubercle, if I'm not mistaken, from the arm position. And on to the next. Actually, that's all of them. And those are my projections you've seen in my video. And I hope you have a nice day.